Have you been seriously injured and have intense pain that limits your personal or professional life? Are you considering a surgery or already underwent one, but your recovery is very slow? If you are undergoing physical rehabilitation and getting poor or limited results, then you should continue watching this video to learn about the three main problems of traditional rehabilitation and how the rapid recovery method, or RRM for short, overcomes them all. The first problem is that in the traditional school of recovery from trauma, the use of surgery is often urged when a non-surgical approach would be more likely recommended for faster and better results. Indeed, surgery is sometimes necessary, and the RRM is highly recommended as the most effective post-surgical rehab program. However, surgery is often prescribed without having considered all the alternatives. A surgery is another injury to your body, and unfortunately, many surgeries do not solve the problem or can even make it worse. You or someone you know may already have this experience. With the help of the rapid recovery method, the need for a surgery has been prevented in many patients for whom the doctors had recommended and even urged operations. Patients with such serious traumas as ACL or meniscus tears, spinal fractures, and partial Achilles tendon ruptures have successfully undergone rehabilitation with the use of the RRM and gone back to their normal lives, even returning to professional sports or ballet dancing. The second problem is that traditional rehabilitation uses a localized as opposed to a systemic approach. Localized treatment can only produce limited results and does not improve the overall condition of the musculoskeletal system. When an injury occurs, the body begins to lose the symmetry and the correct stereotype of motion, which leads to an imbalanced system. You may have noticed that if you have an injury on the left side of your body, you soon develop pains on the right side, as an example. The localized approach cannot correct this problem, and the trauma continues to erode joint health even after the injury has resolved locally. The RRM is the only method of recovery that corrects the entire musculoskeletal system. The local injury resolves at the same time as the entire system is corrected, which results in long-term functionality and vitality of the entire body. The third problem is that the traditional course of rehabilitation breaks the process down into several phases, such as treatment, post-treatment rehabilitation, and only then training to enhance performance, such as excelling in sports or in any other physical activity. This slows the process of recovery tremendously. With the rapid recovery method, all the three phases take place simultaneously. This allows not only to dramatically shorten the recovery period, but also leads to the patient feeling better than prior to the injury and to setting personal performance goals, as many athletes and ballet dancers do who have undergone rehabilitation with the help of the RRM. We have prepared a number of videos and articles on this website to help you familiarize yourself with the rapid recovery method developed by Dr. Popov of Moscow, Russia.
Никаких проблем с той ногой, на которой была произведена операция. Она стала крепче, надежнее. Я чувствую себя более уверенно, чем до травмы.
Please feel free to watch the numerous case studies and testimonials. If you would like to be considered for treatment, please fill out the form at the contact page and we will get back to you within 48 business hours. We wish you rapid recovery.